Good evening. Welcome to the Central and Eastern Sydney Primary Health Network Care Finder Program Industry Briefing. My name is Brendan Goodger. Next slide, please. First of all, I would like to acknowledge the Aboriginal and Torres Strait Islander peoples of this nation. We acknowledge the traditional custodians and sovereign people of the land across which we work. We recognise their continuing connection to land, water and community, and pay respect to elders past, present and emerging. So I'm here tonight with my colleague Jason Phillips, and tonight we'll brief you on the Care Finder program. We will be taking questions tonight, written questions. So if you do have questions, please submit them via the Q&A below, and when we will respond in writing to you within 48 hours. So have your questions ready, and as we present, please type them in the chat and we'll respond back to you. Please note also that the webinar will be recorded and a copy of the webinar will be available on our website in the next couple of days. We might turn to the next slide, please. So tonight, we'll be covering off the purpose of the briefing, introduction to the CESPHN Care Finder program, the Care Finder requirements, the tender process, and questions. Next slide, please. So the purpose of tonight's webinar is to brief you on the Central Eastern Sydney Primary Health Network's Care Finder program, to provide information on the CESPHN Care Finder tender process, and to receive and respond to any questions that you may have. Next slide, please. Just some background information about the Central and Eastern Sydney Primary Health Network. We were established to strengthen primary care, work towards integration across sectors, and commission health services that meet the health needs of our local community. We support people who live and work in the Central and Eastern Sydney region. We have a land area, 626 square kilometres, stretching from Strathfield to Sutherland and as far east as Bondi. There are over 1.6 million people who reside in our region. We have a very diverse population who live in our region. It includes those who are socially, economically disadvantaged, those who come from culturally and linguistically diverse communities. About 40% of our population speak a language other than English at home. We have people living with a disability, people who are experiencing homelessness or at risk of homelessness, and there are significant numbers of those people. We also have a very large LGBTQIA community, and of course we have a very significant and important First Nations communities within our region as well. Next slide, thank you. So just an introduction now to our Care Finder program. The Care Finder program arose out of recommendation 29 from the Royal Aged Care Commission, which was around the establishment of the Care Finder program. And I quote from the report, which said that Australia's aged care system is difficult for older people and their families to understand and navigate. Some population groups, including those that are hard to reach or who have complex needs, face particular challenges in accessing the services they need using My Aged Care. That provides the rationale for and the development of the Care Finder program that's funded by the Commonwealth. So the vision and purpose of the Care Finder program, its purpose is to establish a network of care finders to provide specialist and intensive assistance to help the target population to enter the aged care system and connect with local aged care services and other relevant supports. Its vision is to support all older people in the target population within our region to ensure they get access to the aged care system and find the services and care that they need when they need it. Next slide. So the intended outcomes of the Care Finder program, they are to improve outcomes for people in the Care Finder target population by improving access to aged care services and connections with other relevant supports. To improve the capacity of Care Finder recipients to stay connected to the services that they need post-service commencement. To improve integration between the health, aged care and other systems at the local level in the context of the Care Finder program. Next slide. So in terms of funding and scope, I think this is a very important slide. It's estimated that there'll be a workforce of approximately 500 care positions will be established that will support about 38,000 older people across the country every year. This network of care finders will be established to support approximately 2,500 older people each year within the Central and Eastern Sydney Primary Health Network region. There'll be a budget of approximately $12.1 million that will be distributed over the next 3 financial years, starting from 2022, 23 to 24, 25. Care Finder services are expected to begin in January 2023 and for those services to be fully onboarded by the 31st of April 2023. Care Finder requirements. It's important that we just go through some of the Care Finder requirements, and those Care Finder requirements are set out very clearly in the Care Finder policy guidance document that's available on the Department of Health and Aged Care's website. We've put the link into this into the webinar, and we'll also post it in the chat here as well. This policy document is very clear, and it provides the following information. Next slide. So it provides information on the Care Finder objectives and outcomes, the Care Finder target population, the Care Finder role and functions, the Care Finder organisational workforce characteristics, the service delivery principles, the overarching Care Finder service considerations, referral pathways and connections between programs, matters around conflicts of interest and how they can be managed, complaints. Next slide. The role of primary health networks in the Care Finder program evaluation reporting, and it's also got links to other useful resources, such as the Care Finder's role in the client journey and care finding from the client perspective. This policy guidance document will contain a lot of really key important answers for those organisations considering putting in a tender and preparing a tender documentation. So the target population is generally those people aged 65 years and older, or those 50 years and older if for First Nations. It's also for those older people who are prematurely aged, who are 50 years and over, 45 years and over for First Nations. Also that they have one or more reasons for requiring intensive support to interact with My Aged Care, to access aged care services, and or to access other relevant supports in the community. The target population will also have significant crossover with other special needs groups. Next slide. Other characteristics are that they are isolated or have no support person. There are communication barriers and or limited literacy skills. They have difficulty processing information to make decisions. People at risk of ending up in a crisis situation in the near term, or it might be those people whose past experiences mean they're hesitant to engage with aged care institutions or indeed government. Next slide. Really, the core functions of the Care Finder program is the provision of individual support and the provision of information. It's those two things, provision of individual support and provision of information. The individual support activities include assertive outreach, support through registration, screening and assessment, support post-assessment to access aged care and connect with other relevant support services, high-level check-ins to see if services are still in place and meeting client needs, and importantly, following up support if needs change or services have lapsed. The level of expected support, and there are a number of different bands, it is expected that a significant number of clients in the target population will require at least 15 hours plus support, i.e. band 4. But clearly there'll be some clients requiring bands 3 or 4, but it really is for those clients who are requiring intensive levels of support, typically in those bands 3 and 4, not bands 0 to 1. Next slide, please. In terms of where does CareFinders sit in terms of navigation support, CareFinders really does look at those clients who have complex care needs. It is not for those clients who have the capacity to access the myaged care system through the myaged care website, through interactions with the myaged care contact centre, through the aged care specialist officers and Services Australia, or indeed through the case coordination staff. So CareFinders really is for those people who are requiring intensive support and who have limited other means to access support from aged care services. Next slide. I now just want to indicate to you our tender process that Centres and Sydney PHN will be using. So the request for tender will be issued to an open market and it will be assessed in 2 stages. There will be an evaluation against the mandatory criteria and there'll be initial screening for compliance with the conditions for participation, the minimum content and format requirements, assessment of mandatory criteria. Shortlisted tenderers only will proceed to full evaluation once they've met all the mandatory criteria. Next slide. In reviewing tenders, we will obviously consider best value for money assessment, including scoring and weighting based on criteria specified in the request for tender, presentations, interviews and site visits, security, probity and financial capacity checks. Those are the sorts of considerations that we'll take in as part of our tender considerations. And the contracts with successful vendors will be negotiated. Next slide. So in terms of the tender issue dates, the tender issue date will be, we're aiming for the 12th of August. The tender close date will be the 9th of September. There'll be an evaluation period for the tenders from the 12th of September to the 30th of September. That's pretty tight, but we're confident we can do that. Followed by contract negotiation and development from the 3rd of October to the 18th of November. With the contract start date, we're aiming for the 3rd of January. And then depending on the successful tenderer, bringing organisations on board so that everyone's all onboarded by the 31st of April. Next slide. So some top tips would be that the tenderers should familiarise themselves with the CareFinder policy guidance and relevant tender documents, and we've covered off on some of that tonight. They should ensure that they are compliant with all aspects of the request for tender guidelines. Submissions for the tender can be made via the CESPHN e-procurement portal and tender link, which can be accessed at www.tenderlink.com/CESPHN/. Submissions must be received prior to the closing date to be considered for evaluation. We will not be accepting late submissions. Next slide. Tender documents can only be obtained after registration via TenderLink. Organisations who register for the TenderLink will be made aware of any updates, any amendments to the tender, and of course, any questions and answers that we get, we'll also be providing. Our staff are unable to respond to verbal inquiries in relation to the tender. All inquiries about the tender should be made by email to the following email address: carefinder at CESPHN, CESPHN.com.au. Next slide. So if you do have any questions, then please type them in the chat. What we are aiming to do is to have responses back to you within 48 hours. And I note that there are a couple of questions that have come in. Thank you for that. We'll take them down. We'll send out a response as soon as we can. We'll try to get the responses out to you tomorrow, but at the very latest, it will be within 48 hours. And again, just to highlight that if you do have questions after tonight, please email us at carefinders@cesphn.com.au. This presentation will be available on our website. And I'd like to thank everyone for attending tonight and note your interest and appreciate it. Have a good night, everybody. Thank you for attending tonight.